Hi everyone, thank you for joining us. Another Cam Live tonight with Giliola Spattini, who's been on a couple of times before, so we're so happy to have her back. I'm Nicki. I'm going to ask Giliola in a minute to introduce herself and just tell us a little bit about herself, because we were just having a chat and she does so many things that I wouldn't like to try and recap it particularly well. But first of all, before we go any further, I just want to thank our sponsor who's sponsoring all our lives this year, which is Big Barker. We would have seen this before, but we're so grateful for them for helping us out, and we truly believe in their beds. And you can just even see from the videos how comfortable these beds are. And we've had plenty of people on before who've kind of gone, oh God, yeah, my dog's had that one. My dog's had that bed. It's made a huge difference. So if you are interested in the Big Barker beds, do have a look on our Facebook page. There's often a Big Barker bed giveaway as well. So if you want to get your hands on one of those, all the better. So I'm going to take that off. Thank you very much to them. And now we're going to crack on. So we're going to talk this evening about reading shoulder and elbow radiographs, because this is something that Giliola does a lot of. So if I just pass on to you before I mess up and say anything that isn't true, would you like to introduce yourself, please, and let us know what you're up to?
Yeah, thanks, Nicki. Hi, everybody. I'm Giliola Spattini, and I'm a European specialist in veterinary diagnostic imaging. And my love is radiology and ultrasound. And I'm particularly specialized in musculoskeletal ultrasound and radiograph in lame patient. I work in practice in Italy. I also do telemedicine consultation for an American company, but I read radiograph for all around the world. And when I read radiograph for Japanese people and they write in Japanese, this is quite difficult, but it's quite challenging, yes. And then I'm a teacher. I even teach for a different company in Italy and around the world. And then I also do some teaching online. So I hope that you will like my presentation. I'm usually more used to talk to veterinarian. So please, Nicki, if I get too technical, stop me. And if you have questions, please stop. I will really happy to stop and discuss with you.
Yeah. So if anything comes up that we're using terminology that I'm not quite clear on, or you've got any questions, or if I think actually I don't really understand that, then I'll pipe up and just say, can you explain what that is? But please do ask questions as we go through. And if you have your own dogs that have shoulder elbow issues you want to talk to us about, or anything really to do with the radiographing, ultrasounding, imaging, please do pop your questions down. Hi, Lynn, because Lynn just said good evening to both of us there. So what I'll do, do you want me to look at sharing your presentation now?
Yeah.
You want to pop that up onto your screen and then I'll share it?
Yeah.
And then we can get started. I was just saying, even I'm really excited about this because I deal with a lot of arthritic pets and lame pets in my first opinion job. And one of the things that I kind of fear a little bit are the radiographs and missing things on radiographs. And I will do them a lot. We do lots and lots of x-rays, radiographs in practice. But you do sometimes think, why are we doing this? What are we looking for? How is it going to affect what we're going to do? So it's really good to try and get somebody else to explain this as well, because I do sometimes find that to convince people to do the radiographing or the imaging can take quite a lot, because you have to really know why you want to do it in the first place. So I am going to add the presentation up here. You will still see myself and Giliola. She can't now see us, but I will, if there are any questions, pull them up on the screen.
Yeah. Perfect.
I can see that. All looking good.
Yeah, great. So I'm going to talk today especially about radiology, but I will try to make you understand why radiology is so important. Radiology is important because if we think about movement, we need three different components. The first one is the bone, that is the structure. And then we need muscle and tendon. Muscle generate the power and the tendon storage the power. But muscle is only able to contract and relax. Is not really able to create movement. Fascia, that is a connective tissue, is like a sock that put all together, link all together the muscle and create movement. But the muscle need to be attached to the bone. So if we want to have movement, we need bone, muscle, and fascia. Radiology is the best diagnostic imaging to check the bone. It's also the cheaper and easier. Usually, every country has radiology, apart from Romania, because they have a law against radiation, and for them, it's easier to have CT than radiology. That
So
is
they don't.
crazy.
It's not because they don't believe in it. It's they have a rule against the radiation.
Yeah, you know what is crazy is they have rule against radiation,
Yeah.
and it's quite difficult to have a radiographic machine in your veterinary clinic.
Yeah.
But it's easy to have a CT that is
Yes.
like 10 times more radiation than radiology. But you know, in every country is really peculiar. For example, in India, it's not easy to have an ultrasound machine.
Oh.
For veterinarian, yeah, because they are scared. They're using ultrasound for assessing if a pregnant woman is having a male or a female.
Oh.
And so, for example, in India, you cannot teach ultrasound to veterinarian. They need to move to a different country.
Wow.
But apart from, yeah, it's amazing. When they told me that, I was really shocked.
Yeah.
But apart from these country-related difficulty, otherwise worldwide radiology is available in every practice. And actually, yesterday was the radiology day because the 8th of November 1895 was the day of the discovery of radiology.
Oh wow.
Yeah. So it has been there for quite a while. It's the older diagnostic imaging technique, and actually the first surgical procedure linked to a radiograph was done in January 1896. So 2 months after the discovery of this technique, they were already using for our lame patient. In this case, was a woman with a broken finger.
Oh, okay.
Yeah.
That's interesting. That's actually not that long ago. When you think, I mean, it is a long time ago, but we just take it for granted, don't we? That they're
exactly. And what I found really amazing is that Röntgen was a physician, a physics from Australia, and he gave radiology for free. So basically, he discovered how to create a radiographic machine and then write books, and everybody could build her own radiographic machine for free.
Really?
This was yes. He never became rich, but he really was an amazing person because it changed completely the modern medicine.
Yes. Yeah. It's so useful.
Exactly. This movie is actually created by a CT, but is what radiograph show you. This is the bone of a walking dog. And this movie has been created by advanced technology by Martin Fisher, again, a physician, basically expert in physics and mathematics. And he studied a lot about the movement of our patient and let us understand that every structure, every bone is linked to several muscles, and every single changes that we see in the bone are most likely related to muscle problem. So they're so close together that really we need to know radiology, ultrasound, and then what is very, very important, the physical examination.
Yes.
So what to touch, how to palpate our patient, that is the most accurate diagnostic that we have. However, to explain you in the ideal world how what should happen is, let's say that your patient is lame. You go to the veterinarian and find out that the pain is in the shoulder.
Mm.
So usually the specialist that checked the lame patient is an orthopedic surgeon. And it's very important to understand where is the source of pain, because if we want to do imaging, we need to know what we are looking at.
Yeah.
And definitely the first step is radiograph. I'm going to explain you why.
Mm-hmm.
Because most of the time you have finished, you have your diagnosis. If you have a fracture, so a broken bone, then you will schedule to fix it. If you have arthrosis, then you are scanning your treatment. And if you have neoplasia, then you will call an oncologist and
Yeah.
so on. When radiographs are normal or not conclusive, so the changes are not so severe that will explain the problem of your patient, then you might need other modality. Ultrasound, MRI, CT, or arthroscopy, or these modality will be needed, but only after radiograph.
Mm.
For example, I don't accept patient for an ultrasound of the shoulder if I don't have radiograph, because radiology will see the bone.
Mm-hmm.
Ultrasound will see the muscle and the fascia, but I will not be able to see the bone. So I could diagnose a tendinitis, but I could have a tumor in the bone
Yeah.
that will miss if I don't have radiograph.
Mm.
This is so important, and this is why we really need to have the first step, that is radiologists. Even if it will be normal, at least I will rule out major problem.
Would you ever go straight for a CT rather than a radiograph?
Rarely.
Okay.
Rarely, probably the only exception could be elbow.
Yeah. Okay.
Because in elbow, we have 3 bone connected together
Mm.
and they overlap.
Mm.
And the good part of CT is that we can avoid overlapping.
Yes.
But most of the time, I would say 99% of the time, radiology will be my first step.
And even in those elbow cases, I think you said before, so the radiology is much better for shoulders anyway. You would
Yeah,
still
well,
need to be checking the shoulder, wouldn't you? You wouldn't just assume it's only the elbow that's a problem.
yeah. Usually, the good part about radiograph is that you can really use them also as an overview. With the advanced CT that we have now, actually, they're so quick that maybe you can save some time taking a quick scan CT instead of doing like 10
Every X-ray.
radiographs.
Yeah.
So nowadays, it could be that it could be a good idea to jump to CT in particular cases. For example, in a polytrauma patient, CT has a big advantage also to check the lung, the vertebral column. So if I have a polytrauma patient and I have the money, definitely
Yes.
CT will be much better.
And of
But
course, that is the other consideration, isn't it? That financially,
Absolutely.
it's not always an option anyway.
Exactly, because usually radiographs are much cheaper than CT.
Yeah.
Not in Russia. In Russia, CT are nearly cheaper than radiograph. It
Why is
depends
that?
where you. I really don't know.
Oh,
But I was surprised. Yeah, I
interesting.
think it's just politics and how veterinarians decide to.
Yeah.
I was really surprised the
Yeah.
price of CT in Russia.
Fair enough. You learned something new. Well, I'm learning lots of new things this evening.
Yeah,
But yes.
well, before COVID and before the war, I was traveling a lot. Now
Right.
I'm more at home. Yeah.
Yeah.
Okay, but let's see how we should do radiograph and how we can see radiograph. This is the classical mediolateral view of the shoulder. That means
So,
that the beam is medial, so
yeah.
in the inner part, and the lateral part of the shoulder is on the table. And you understand why we need sedation. Because we need to take radiograph, but we need to take straight radiograph. So the bone need to be aligned. And to have the bone aligned, we need to flex 90-degree the elbow and the carpus. The
Yeah.
carpus is the distal portion. And then you need to take out the upper limb, otherwise it will be superimposed. And then we need to lift the head so we will not be superimposed. And these, you can see what a radiograph show you. Beautiful bone, while the soft tissue that are the muscle, the tendon, are all gray. You see a little bit of definition because they have a little bit of fat that show you different muscle, but otherwise you don't see tendon, you don't see muscle, because with radiograph you see the bone.
Yeah, I think that's a really useful image actually, because I don't know about yourself, but I get a lot of questions say, well, can I just hold my dog for the x-ray, or can you just hold the dog for the x-ray? And no, you can't, and you will never get a dog to lie in that position
No.
without some sort of
Yeah,
restraint
will
sedation.
be, yeah, the problem is that if you don't allow, if you don't align the radiograph
Mm,
perfectly, you have non-diagnostic image. So they
yeah.
are not possible to read. And
Yes.
you have exposed yourself and your dog to radiation, and you
Yeah.
have a no diagnostic study. And
Yeah.
nowadays the sedation that we use is so safe
Yes.
and quick that really is worth it,
Yeah.
because really the diagnosis means that you can treat your patient
Mm,
in the best of the way. And okay, now we have a radiograph, but how we should read the radiograph? Because it's not so easy, but the best way to do it is to be systematic. And I use the ABCDS method. It's just one way to look at the radiograph. ABCDS method is like A is alignment. So I check if the two bones are perfectly aligned. So there is no luxation. Luxation means that the joint is gone and one bone is far away from the other. I check if there is angular deformity. Sometime in puppy, when they have trauma to a bone that is still growing, it tend to start to be kinked and deviated or deformed.
yeah.
Or deviation usually is when you have a fracture, and when the two fragments heal, they don't heal in the good axis, but they have a kind of an angle. Bone, B is bone. So I check to see lysis, that is big, like hole in the bone, that is a bad news,
Yeah.
or proliferation, that is when there is some bone that is growing, and we can see that in arthrosis, for example, in infection, or sometimes we can say fracture. So the bone will be disconnect and you will have two or more fragments. And this is a big problem because when you have a bone fracture, then all the muscle are not stable and the patient will not be able to use the limb. And
Yeah.
then C is for cartilage. Cartilage is a layer, a fantastic layer of tissue that covers the joint. So with cartilage, we are meaning the joint. And why cartilage is so important? Because cartilage doesn't have nerve. That means that there is no pain. And the reason why cartilage is covering the joint is because you can jump, you can put a lot of pressure on the cartilage, but the dog will not be painful. In
Yeah.
fact, the big problem happens when the cartilage is damaged. So the bone will kick on the other part of the bone and then pain.
It's painful.
The major problem with arthrosis is that you can end with a cartilage damage.
Mm-hmm.
and then you will start to have pain. Sometime in radiograph, you can see terrible arthrosis,
Mm-hmm.
awful, and the dog is absolutely fine. And the reason why is because the cartilage is still intact.
Yeah.
We really need to be very careful with our cartilage. And so degenerative changes is what we can see most of the time in our joint. And CAM is trying to prevent them,
Mm-hmm.
avoid them, and reduce them. And then luxation again. So basically, the two bones are not in the same joint. And then again, we can an articular fracture that are the worst
So
because
can you just explain what the articular part
yes,
means?
is basically a fracture that is affecting the joint surface. Why the joint is so important? Because joint is useful for moving, but is especially useful to spread the pressure.
Mm.
For example, when a dog is jumping, in the muscle and front limb and partially goes to the bone, he carry 4.6 times his body weight.
Mm.
If you have a border collie that let's say is a little bit big, is 20 kilo,
Yeah.
and he jump on the front limb spread by the muscle, tendon, and bone is actually have more than 90 kilogram.
Wow. That's,
With the joint, basically, more space you have in the joint,
mm.
more this weight and pressure is dividing all the structure.
Yeah.
But if you have a little step in the joint, all the weight will go in the part that will be upper and will be closer to the other part of the joint.
Mm.
And this will be terrible because we were 90 kilogram in 1 centimeter.
Mm.
This will deform the bone
Yeah.
and this will create arthrosis.
Which is one of the things we talk about so much, and it's really lovely to hear sort of the beginnings of why we talk about those things and why we talk about the impact of exercise and then go on to treatment options as well. It's really a lovely way to explain it.
Yeah. And this is very important. So joint, we really need to keep our cartilage safe
Mm.
and our joint healthy.
Yeah.
And then D is for device. Everything that the vet put on the bone. A plug to cure a fracture, is making a hole to put some surgical device. In
Mm.
this case, there is no device. And then S, that is actually, I start reading with S. S is soft tissue, so muscle and tendon.
Mm.
And we are looking for swelling. Of course, with radiograph, we will not be able to say which part is swelling,
Yeah.
but we just see that one area where we know which muscle and tendon are is
Mm.
thicker and less defined. And then we can see, for example, emphysema, typically a bite. When
Yeah.
you create some hole in the skin, you will see, for example, the air can enter in the soft tissue, and you will more or less know how deep is your trauma.
Yes.
And then mineralization. Sometimes, if you have a trauma or a chronic tendonitis, the healing process it became dystrophic. That means that instead of going back to normal tissue, you will go back to scar
Mm-hmm.
or even worse, mineralization. Take calc deposition. That means to have a little stone in your shoes, because
Yeah.
if you have a tendon need to slide and you need to slide on a little stone, this
Yeah.
is the mineralization, then you can understand that it will be
The
painful.
pain.
And
Absolutely.
yeah, and again, treatment usually are fundamental to avoid that a trauma became a mineralization or scar instead of going back to normal tissue.
Mm-hmm. Yeah. So much just from one image. There's so much stuff you're
Exactly.
looking into, aren't you?
Yeah. I need to make you understand something, there are two specialists looking at radiograph. There are radiologists and orthopedic.
Mm-hmm.
And we look at the radiograph in a different way.
Mm.
And there is a good reason why. Orthopedic like to have the shoulder in exact position of when they will have the shoulder on surgery.
Yeah.
That means they will have the uh, right in one way and the left in the other way.
Mm.
And for them, is very, very important for planning the surgery. So right and left shoulder, they will be opposite.
Yeah.
And this will be the orthopedic way of looking at radiograph. And I really understand and appreciate that, because for them it's easier to plan their surgery if
Yes.
you will have the bone exactly how you will have in your surgery. But radiologists, we are a little bit lazy. That's not true, but we need to know anatomy very well. And for us, it's easier to have the two shoulder in the same position, because then will be much easier to see similarity and difference.
Comparison. Yeah.
Yeah,
Yeah.
exactly.
I think that
So,
makes perfect sense. Yeah.
exactly. So really, if you're a radiologist, you will usually won't have the head of your patient in that direction and the tail in that direction. If you're an
Yes.
orthopedic, you will have the limb, how you will see during surgery.
Yeah.
And then there is another big difference about terminology. Orthopedic like to create and to tell anterior posterior, that
Yes.
is cranial, but this is actually a human terminology. And they do that because there is a big connection between human orthopedic and veterinary orthopedic.
Right.
Radiologists like to call a different way, but it doesn't matter. These are the only, what can I say, difference about radiology and orthopedic.
So the
But
anterior means the front and the posterior means the
exactly,
back. So cranial that's how we say it, cranial head end, don't we? And caudal bum end, basically.
exactly. And till now, I've shown you the medial lateral.
Mm-hmm.
That is
So
the
medial lateral
easy.
means on the side, like the previous image was.
Exactly, where the beam was entering the medial aspect and the lateral aspect was on the table. But
Yes.
we always need at least two views.
Yeah.
And the reason why we are transforming a three-dimensional structure in an image
Yes.
will be so dangerous to have a single view, because we will lose the depth, because everything will be on the same plan, and we really could miss diagnosis. And
Yeah.
you can see that you cannot have this view done in a wake dog.
Yeah. No, I
Your
mean
dog
you can
will
see
be
how far that leg is stretched out like this. It's not going to happen. They've got to be perfectly in line, haven't they?
exactly. We need to fix cranially, and we need to have the head gentle put in one side, because we need to we don't need to have superimposition of the head with our limb.
No.
And then to create a little bit angle, because we need to put away the rib cage, that is the thorax. We need to rotate 10 to 30 degree the hind limb on the opposite side.
Yeah.
It is easy and complex at the same time, but if the dog is awake, it's just impossible.
And also things like I've been caught out before where a dog's had a really massive collar on, and if you leave that on, those little things can really interfere with your radiographs, because it picks
Absolutely.
up everything.
Yeah, and there is also another problem. Usually in the collar, there is some metallic part, and
Yes.
metal, if it's hit by X-ray, create radiation. That means that your image will be horrible.
Yes.
And then there is the Morphy law. Whenever you have something superimposed, it will be superimposed to your lesion, hiding your lesion.
Mm.
So color definitely need to go away.
Off. Yeah.
Yeah. And then we need to center exactly where we want to take our radiograph. And again, if you're a radiologist or if you're orthopedic, you will love to check in a
Yeah.
different way the shoulder, but it's not a big problem. And then we have the elbow. Elbow is even more important for radiograph, because while in the shoulder we have a very important soft tissue component,
Mm.
and this is why ultrasound and MRI play a very important role. In the elbow we have a lot of bone and very little tendon and
Mm.
muscle, and with radiograph we can see very nicely. As I already told you, CT is even better because you will avoid superimposition of the bone,
Yeah.
but most of the time radiology is enough to have a perfect diagnosis. And again, we need to flex from 45 to 135 degree, depending in what you're looking at. And we need to push a little bit the thorax to avoid superimposition,
Mm.
especially in Labrador, for example. We have a lot of skin in the sternum, and we need to avoid superimposition.
So why, can you just go through again with people why it's so important that we just don't let the leg flop as it wants to and we keep it
Yeah.
in that flex position?
Is very important, because otherwise, you see, this is the result, the radiograph that end by doing this flexion, 90-degree flexion. And you have three bone, that is the humor, the radius, and the ulnar. They are exactly the bone that we have in our own arm.
Mm-hmm.
And when they are joining together, you need to see a very nice uniform joint space, even if they are three bone.
Yeah.
If the leg is not perfectly flexed 90-degree, you will not see this joint, but you will just not be able to see exactly how this joint will look like.
Yeah.
I don't
We've
know if
just
it's clear.
I've just got a little question here from,
Yeah.
well, there's a couple of questions. I'm going to ask Maria's now. I'll come back to yours in a minute, Katerina. There's one here just out of interest. Does CT require the same positioning of the dog as radiographs? And would a dog in pain be more comfortable with CT?
Well, usually no. The position is a little bit different. Sometimes is similar, but is majorly different, because with CT you acquire the image rotating surrounding the dog, and then you can reconstruct every single plan that you like. So actually, with the newer CT that we have nowadays, will be quicker, and probably the dog will be in more comfortable position.
They
Consider that
still
when
require
we
a sedation, though, don't they? It's not
oh
something
no
you can
no
do.
with CT sedation, absolutely yes,
Yeah.
is even more important than radiograph, because in CT the table is moving.
Yes.
Could you imagine your dog on a
Just jump
table
off.
in, with the stretch leg? Because,
Yeah.
however, you need to position the dog. It's not like the dog is, you need to
No.
position, and then there is a noise, and then the
Mm.
table is moving. Uh, with radiograph and CT, however, when you do the sedation, you add painkiller. So you're sure that you're not creating more pain or
Yeah.
discomfort in your patient. And sedation, one of the major need of sedation is also to avoid pain.
Yeah.
But in a way, CT could be a little bit less discomfortable, because the dog will be only in one position.
Mm. I hope that answered that question. I think it does, Maria. If you've got any other questions, please jump in. Thank you for explaining that.
No problem. Okay, so this is what we want to see. Very nice alignment of the three bone. And this is the other view. This view, you see the position of the patient, because we need to avoid superimposition of the bone. So we are angling 15 degree medially the limb to see the medial aspect of the elbow. In a few minutes, I will explain you why. Because the elbow is unfortunately quite often affected by dysplasia.
Yeah.
Dysplasia is a wrong development in young puppy, and I'm sure if you have a Labrador or
Yes.
other breed, the veterinarians or the breeder suggest you to take radiograph when the dog is from 4.5 to 6.5 months of age, depending on how giant the dog will become, because we are looking for elbow dysplasia. That is abnormal development, and sometimes they actually are born normal and then became affected, and this will create arthrosis and create problem. And to add that, you need to angle in that way your radiograph. Let's see a patient. This is the classical patient. Is a German Shepherd, my neutered 3 years. This dog actually came from Canada, and he slept on the ice again,
Oh,
and he was now acutely lame on the left front limb. He had pain actually localized on the elbow, but it's not easy to perform a physical examination in a lame German Shepherd because
no,
it's a big dog and they can be a little bit anxious. You don't want to create more pain.
no.
So sometimes it's quite difficult. And then if you sedate them, you cannot always understand if it's painful or not because they're under sedation.
I'd
So
say this
usually,
is a really common presentation.
yeah,
German Shepherds, Labradors, they do something silly, and yeah, really common.
exactly. And because most of the tendon and muscle, they start in the shoulder and they finish in the elbow. Usually, if you have elbow pain, you need to include the shoulder.
Yes.
So these are the shoulder radiograph.
So you can see there's the one from the side that Giliola was talking about, and then the one with the legs stretched backwards as well, or
Exactly.
headwards.
Exactly. And my advice, because every single animal is different, human doctors are quite, lucky because humans are quite similar. But dog, if you consider a Chihuahua and a
Yeah,
Great Dane, they
yeah,
change a lot. So what I usually do, I always set normal to compare
yes,
with my patient.
yeah,
And if they are veterinarian, they might have noticed that there is a big disaster in the shoulder because you see there is a step in an area where the bone should be not divided in two. So there
no,
is a big fracture.
ouch.
And look at the craniocaudal view. There is
Oh
like two
yes,
bones. This is dramatic. And to be honest, if you're not a specialist, that means that you are reading 20 cases of shoulder every day. And
yeah,
so the normal is in your brain. Would be easy to miss. Because even if I have a bone that is split in two, is not so easy.
no,
And then fracture line, you see this loosened, so black line in the bone. The bone is just imagine a plate that is partially broken, not totally, because you see that the two fragments are still
still
together.
together. Yeah, yeah.
Yeah, but this is quite a very bad fracture.
I'd see that bottom one, and now with the arrows, but I would not see that, I don't think. Those fracture
I
lines.
know this was really a tricky case.
Yeah.
And if you, and this is why I always advise veterinarian to take the two views,
Yeah.
the affected limb and the normal limb,
Yes.
because
Even with
otherwise,
that, I wouldn't be sure that I would have seen those fracture lines. But
I know. I
yeah.
know. Radiology can be difficult, and this is
Yes.
why you need to be systematic.
Mm.
But once that and then remember, we were considering the problem was in the elbow. So when
Yeah.
you think the problem in the elbow, you will tend, because in humans, okay, I need to do the shoulder. I know that. And the reason why is because sometimes elbow problem is shoulder pain.
Yes. Yeah.
But I'm not expecting nothing
No.
particularly, so I will not probably spend too much time on that.
Mm.
Instead, it's very important to check carefully. So this to tell you, in a city, it will be so much easier.
Yeah.
But especially because in this area, you have superimposition with the spine, the cervical
Mhm.
spine, there are the horizontal bone, and then you have the rib, you have the other leg. But however,
You
you
can
can
see
see
that
a
other
lot.
leg very clearly there, can't you? And in some dogs, it's very difficult to not get that in the way.
Oh,
It's just one
yeah.
of those things.
Exactly. For example, English bulldog, you can't just
Yeah.
keep the leg in front because they are so thick. They
It
just
won't work.
cannot.
Yeah.
Exactly.
It can't do it.
Oh,
Yeah.
exactly. So this is, like explosion on the bone, but the good news with the shoulder is that it's surrounded with so many muscle
Mm.
that is like is in a cast. So even if it's dramatic, if it's not affecting the neck, the neck is the narrowest part,
Yeah.
just above the joint,
Mm.
this is a conservative treatment. So
Really?
you don't need, yes, you don't need to do surgery in this fracture. It's amazing how
Because there's
nature
no,
really,
the bones are still the fracture line that, like you said, like a plate, they're still together. They've just got the fracture up them. So as long as they stay close together.
exactly.
Mm.
Exactly. So you need to avoid this dog to sleep again in the ice because
Yes.
otherwise it could be a disaster.
Yes.
And you cannot keep the dog too um, without moving because you need the muscle to keep the
Yeah.
bone. So
Yeah.
usually this is a job for physiotherapists because they
Wow.
need to teach you which exercise you should do with your dog
Yeah.
and which you should avoid,
Mm.
because if the two fragments slip away, then will be a big problem.
Mm. Gosh. So was that dog still weight bearing, but just very lame?
Was very, very lame at the time.
Yeah.
And this was the other view. Actually, the elbow was absolutely normal on
Yeah.
radiograph.
Mm-hmm.
It's very likely that has some muscle here because you see the fracture in the bone, but you should consider that in that bone there is muscle
Trauma.
attachment. So hematoma and some
Yeah.
trauma was surely happening.
Mm.
And then basically this what was found. And the dog went on conservative treatment
Mm-hmm.
because I told you what you have to do when you have a fracture is keep the fragment together. But
Yeah.
thanks to the muscle,
It's doing
they are stable. And this is 8 months later. You see that the technique is a little bit different.
that. Mm-hmm.
But 8 months later, you see the fragment are back together. There
Mm.
is a little bit of step, but luckily is just few millimeter away from the joint.
Mm-hmm.
So it's not really a joint fracture. And you see there is no arthrosis.
Not, no, no.
Exactly. So this dog is going back to perfect
Yeah.
and is amazing.
Do you know
And
what they did treatment wise? Did they do lots of physio or
oh, yes.
they did? They did the
They
right.
did a lot of physio. I don't know exactly which exercise.
Yeah.
I know that as far as after, well, for the first 3 weeks, and 3 weeks is the time that you need for a fracture to heal in
Mm.
a healthy
Younger.
bone.
Yeah.
They were walking.
Okay.
progressively walking in a flat surface.
Mm-hmm.
And this was most to keep the dog calm. They were doing a lot of mental
Yes.
exercise,
Yeah.
when you need to think. And
Yeah.
animal and dog tend to be, to become physically tired when
Yeah.
you make them work a lot with their head,
Mm.
because you need to
A
not have
3-year-old
too
German
much
Shepherd.
energy.
Yeah.
Exactly.
Yeah.
And then I know that it was after the 3 weeks was using water treadmill.
Hydrotherapy.
Yeah, exactly. But I
Mhm.
cannot really tell you exactly
Mm.
which protocol. And then uh, when the bone was healed,
Mm.
I think they also had some laser, I think,
Okay.
and Decker. But I cannot really tell you exactly.
Yeah. But they did what they had to do anyway, which is obviously.
Exactly. And then after 1 month, a lot of exercise at home
Hmm.
with the pin-up, and they were trying to work on the triceps and
Yeah.
to make sure that the muscle tone was stabilizing the fracture.
Mm. Lucky dog.
Yeah, yeah, absolutely. Because it's not always. This is a less lucky patient.
Okay.
He's 10 years old. When I saw this patient was the first time that I heard of this breed.
I was going to say, where
Training.
was this? In Italy?
No, this is from US. I
Okay.
speak in telemedicine. This is training Walker Coonhound.
Okay.
The other dog, the German Shepherd, was from Canada.
Okay.
And he was hit by a pickup this evening.
Mm.
We have very few pickup in Italy, so pickup is typical for the US. And he has a deviation of the right elbow,
Hmm.
and there are several lacerations. So you can see the skin that is break,
Okay.
very nasty wood. You should never do a single projection,
No.
because, as I told you, you have a two-dimensional structure, and when you take a projection, you create a two-dimensional image,
Yeah.
and you don't see the depth. So, for
Mm.
example, here is gas in the
Mm.
soft tissue, and
Yeah.
there is the skin laceration, so the gas enter, and you can see that the trauma is getting very in depth.
Yeah, it is, isn't it?
Exactly. And this is how the normal leg
Yeah.
look like.
Hmm.
And you should already see that you cannot really see the joint margin, the little black line that
No.
surround the joint.
No.
And you know why?
I suspect I know why, but we need to do the other
Yes,
view.
absolutely. This is why.
There we go.
This is
So,
a terrible luxation.
so there's the right one
So
is the affected one, and then this other one next to it on the left there
exactly.
is the normal one, the good one.
Exactly. So the left side is normal alignment. There is a little bit of arthrosis, but nothing really.
Hmm.
But on the right side, the joint is gone. And the big problem is it seems easy because the joint is like you put back the bone,
Yeah.
but if there is luxation, the tendon, the ligament, the muscle are all gone,
Ruptured.
are
Yeah.
not able to keep the joint back together.
Yeah.
So usually the treatment is a nightmare, because to make all this structure heal, you
Mm.
need to avoid stressing.
Hmm.
But if you don't move a joint, then you will lose the movement.
Yeah.
So this is
Yeah.
really an orthopedic
Nightmare.
drama. And sometimes, if you only take one radiograph,
Mm.
you could miss them.
Yeah. Yeah. And if
So
you didn't have that normal one in your mind, if you wouldn't,
exactly,
well, it's kind of okay, but yeah, there's a huge issue that you're missing.
exactly. And then this will be a very, very nightmare for the orthopedic surgeon.
Mm.
They correct surgically, and then they put a cast for the first 2 weeks
Yeah.
Only 2 weeks because they need to move as soon as
Movement.
possible the joint.
Yeah.
And was lucky because he was able to move the joint after the treatment, the surgery, and the cast. But the reduced ROM, it means that he's not able to move all the way, but the angle that is able to do is a little less. And in end up
So
1 year later with a first degree lameness that is a
yeah.
minimal lameness, and was a mechanical lameness because it was not really able to extend all the elbow,
Yeah.
but the progression of arthrosis was minimal, so was quite a good outcome for a very, very bad
Yeah.
condition.
And it was already 10 years old when it happened. So that
Yeah,
in some dogs, there may well have been far more advanced arthritis going on, and then surgical options or post-operative care would have been, it could have been disastrous, really, couldn't it?
yeah, yeah. And
So
also in this case,
just to go back to one of those comments there where it says final results, moderately reduced ROM means range of motion, just for anyone that didn't pick up on that. But yeah, lucky dog again in the end, but
absolutely.
really bad injury.
Yeah. And also this patient went to physiotherapist, and, especially when you have a cast in a joint, you have destruction of the ligament, tendon, muscle, and then you need to move again the joint, and to be sure to avoid scar as much as
Yeah,
possible and
yeah,
mineralization as much as possible. Also in this case is very useful. I think especially ultrasound and laser,
laser.
I think is what they tend to use, but I'm not a specialist. I'm studying some physiotherapy just because I need to understand what could help my patient when I found ultrasonographic lesion in tendon and muscle, but I'm
Yeah.
not a physiotherapist. I will
I mean,
never
it
be.
all kind of ties in together, doesn't it? You kind of,
Yeah.
once you understand how the muscles are working and that combination with the fascia and the muscle and the bone, you understand more of where physios are coming from and why some of the exercises that are suggested, why they're going to work or why they're going to help. It's all kind of connected, isn't it?
Exactly. Just a very short review why elbow radiography is so important in young patients, because we could have elbow dysplasia, and there are actually 5 conditions. The first condition will be not united uncanal process. This little, very nice cone of bone has a different ossification center, and could be that it is not united at 5 months of age. So we need to check if this is, like in this case, attached perfectly.
Yeah, yeah,
And then bone incongruency. So you see this very nice black line that join the 3 bone together. This is
yeah.
the joint. It needs to be symmetric. And if there is a step, this is incongruency. And this is why we need to flex the carpus to be sure that we are not creating false incongruity. And
Okay.
then what is very, very important is to check the fragmentation of the chronoid process. That is a little bone, better seen in the craniocaudal view. That is the little triangular margin of the ulna, that is the medial and distal aspect of the joint. And when you start to have problem in this part, you see that the joint, instead of being so sharply demarcated that
Yeah.
with a pencil you can draw a line, you start to see bone proliferation and irregular margination. And then
Do
you
you
need to.
find with the elbow dysplasia that actually sometimes it's always useful to do both elbows, but if both elbows are affected, then you're not comparing normal to abnormal.
No, but I
This is
always
both
have a normal atlas.
in your head.
I have a
Yeah,
normal digital atlas in my
yeah,
computer,
yeah,
and my brain is set to normal. This is
yeah.
one of the most difficult thing of our job. We need to learn what is normal,
Yes, yes.
and then it's very rare that pathology is at the same degree
in both
So most of
elbows.
the time they will still be different,
Mm-hmm.
even if they will be both affected.
Mm-hmm.
And then osteochondrosis that will affect the part of the humor. So fragmented choroideo is the ventral aspect of the joint or the distal, while the osteochondrosis will be the dorsal, so the humerus will be affected where the pink line is. And
Yeah.
then the next will be panosteitis. This dog is normal, but
Yeah.
with panosteitis, just imagine that the medullary part, so the central part of the bone, will become white
Mm-hmm.
because of inflammation. So you can see how many plays
Yeah.
we have to check when we look at radiograph of our puppy or young patient.
Yeah. And this is probably why, and maybe some people have experienced this and thought, oh, well, why is my vet sending these x-rays to an orthopedic specialist? Because they're a vet, they should know. Their first opinion vet,
Yeah,
they should know what they're looking for. If you look at all those circles and you think there's somebody that's just doing this as their first opinion job, sometimes would like an orthopedic opinion, this is why, because you're not just looking at one thing. There's a lot that you need to get from that x-ray.
exactly. And then my last patient is a very challenging and difficult case.
Mm.
Is a 11, she's a lovely 11 years old female spayed Labrador.
Mm-hmm.
And when I saw this patient, actually, she came from an ultrasound of the shoulder, but she was lame for the last 8 months.
Okay.
Initially, so 8 months ago, she was a little bit lame and she responded very well to anti inflammatory
Uh-huh.
drugs.
Yeah.
But she went back to be lame 1 month later. And because of that, uh, they took radiograph
Mm-hmm.
and they checked the spine because sometimes lameness is due to nerve compression.
Yeah.
And this was a normal cervical spine. And then they took radiograph of the shoulder. And if you remember well the normal shoulder,
Mm-hmm.
I shouldn't have this mineralization in the area of the tendon of supraspinatus.
Yeah.
That mineralization in a tendon that should, run could create some problem.
Yeah.
And then a little bit irregularity where the bicep tendon attach, and we're looking at the right side.
Yeah.
And then the caudal margin of the articular surface of the scapula is not completely mineralized, that sometimes can create lameness.
Okay.
And then this little bone proliferation is where the tricep muscle attach. That
Mm-hmm.
means there is a muscle problem,
Mm-hmm.
but we are talking of the non-lame limb.
Right.
Okay. And then there is a little bit of arthrosis. On the other limb, a
Yeah.
little bit of irregularity where the bicep tendon attach,
Mm-hmm.
tiny bit of arthrosis, but actually it's much better than the
Yeah.
non-affected. Okay. And then elbow. The upper image is normal.
Okay.
The down image is first on this side. There is the left, that
The
is
bad
the
leg.
elbow that is affected.
Mm-hmm.
And then there is the right, the non-affected. You can see that the margin, the articular margin, is irregular. The joint are not so sharp,
No.
but there is, for example, more white bone here. There is a sclerosis of the ulnar notch, the scientific term, that usually you see that when there is a fragmentation of the choronoid process.
Mm-hmm. Which
And
is what
then
you were just talking about with the elbow dysplasia,
exactly,
choroid
elbow
process.
dysplasia. And then you have some bone proliferation. Look
Mm-hmm.
how rounded and irregular are the bone margin.
Yeah. Yeah.
So there is arthrosis, my job is done. I have a diagnosis. But what the problem? That the right side is exactly the same.
Yes.
So why on the
Is
left
she only
side
lame?
I'm lame for 2 months,
Yeah.
And on the right side, I have nearly worst osteoarthrosis.
Yeah.
The dog is absolutely fine. And this is probably the major limitation of radiographs. Sometimes is not correlated with the clinical sign.
Mm.
And the reason why is because if we don't have a break cartilage, I can have terrible elbow, but
Yeah.
be absolutely fine. Second, I don't see the tendon and the muscle.
Yes.
Okay. And then, especially in Labrador, while this was the comparison that show you the left and the right, they're
Mm.
absolutely the same, more or less degree.
Yeah.
We use a different filter. And you see, we flex more the elbow to be
Yes.
able to see better the anconal process and degree of arthrosis.
Yeah. Yeah. So in order to, depending, like Giliola said at the beginning of the talk there, depending on what you want to look at, you need to place your leg in the right position. So you flex it up even
Exactly.
more to see what's going on behind that joint there.
Exactly. And then hand, because especially in Labrador, they tend to, over time, have a lot of arthrosis in the digit because they
Yes.
jump so much, but
Yeah.
the hand of Tempesta were just perfect. So we have a lot of finding, but nothing is so conclusive. So we call
No.
it inconclusive because we have arthrosis, but it's bilateral. And one
Mm-hmm.
side is terribly lame and the other one is not lame.
Mm.
Um, the reason why we have to do radiology is because we have a diagnosis that is arthrosis.
Yeah.
Could be not the only problem of this
Yeah.
patient, but is very important to know that.
Mm.
So we decided that arthrosis was a problem, but the veterinarian decided arthrosis was a problem. And because was not completely responding to non-steroid anti-inflammatory
Mm-hmm.
drugs, they start with physiotherapist.
Yep.
Initially was very effective, but after a while, lameness came back.
Okay.
So they tried alternative medicine. The problem is when yourself or your dog is lame and traditional medicine is not working, you are tend to try everything
Of
to
course.
avoid. The problem is was not working. So
Mm.
they decided after 6 months of back and forth lameness, and the lameness was getting worse and worse, to
Okay.
go for CT. CT is basically radiology, but obtain a 360 angle. So
Yeah.
basically, you are looking all around your bone, and you don't have superimposition. You do
Mm-hmm.
see a little better the joint, and you can reconstruct in several different ways. These
Yeah.
there are some on the right shoulder. There are some white spots
Yeah.
outside the bone, and
Yeah.
these were part of the alternative treatment.
Oh,
Implant on the other shoulder should help the other side. However,
right.
yeah.
Okay.
Okay, the CT was considering a little bit of arthrosis in the shoulder joint, but we have already saw it in the radiograph.
Yep.
There was some proliferation where the bicep tendon ran. So it's
Mm-hmm.
like you have a regular bone. So when the bicep tendon ran on the shoulder, it could be inflamed,
Yep.
but this was bilateral. And why only on the left side we had the problem?
Yep.
We had on the left side less muscle than the other side. That means
Mm-hmm.
that the dog is using less the
Yeah.
leg. And so they found out with CT that most likely was a tendonitis
Gosh,
because there was not enough evidence on the arthrosis to really explain why the left
why
side
it's
was so
more
lame.
lame. Yeah. Yeah.
And this is when the dog came to perform an ultrasound
Okay.
because they were trying to work on this tendonitis, but the dog
Mm.
was not really responding.
Mm.
And usually, ultrasound is very good in checking the tendon and the
Yeah.
muscle. And you can also use ultrasound to guide some treatment, for example.
Mm-hmm.
And this is how some muscle in the shoulder look like. And the shoulder was absolutely normal.
Okay.
But usually, especially in a patient with this history, I check some other things.
Mm-hmm.
But what I want to tell you that the shoulder was absolutely normal in ultrasound. So what we are going to do now?
You're gonna go down to its elbow.
The CT was done also on the elbow. I
Okay.
did also the elbow on ultrasound. I always scan the elbow when I
And
do
shot.
a shoulder
Yeah.
ultrasound
Yeah.
because, for example, the bicep tendon end and muscle end in the elbow.
Mm.
And ultrasound is so good in checking pain. The elbow were absolutely chronic osteoarthritis, but no pain.
Would
I
you
didn't.
would you would you consider checking the X-rays again?
I would
Repeating.
consider the best diagnostic imaging possible, that is,
Okay.
go back to physical examination. So I put together what we have in our patient. Progressive left front limb lameness in 8 months is
Mm.
slowly getting worse.
Yeah.
Radiograph, not conclusive. After 8 months, I have a severe left shoulder muscle atrophy.
Yep.
CT reported negative, ultrasound of the shoulder negative. What is very important is severe muscle atrophy.
Mm-hmm.
We have two possibilities. The dog is not using the leg. If you don't use your limb, your muscle will be
Waste.
gone.
Yeah.
Is exactly the opposite that if you go to the gym.
Yeah. Yeah.
Or what is the structure that make the muscle develop? Nerve.
There's some
Actually,
neurological.
actually, I did scan the plexus brachialis of
So
this
a little nerve
dog.
group of
Yes,
nerves tucked up
exactly,
underneath the armpit, basically.
exactly. And I found a lump there,
Oh.
a nodule. I took sample, and there was suspicious of a tumor
Oh
of
no.
the nerve. What we should do now? Nerve tumor. The good news is that, especially the one that grow slowly,
Yeah.
they are only aggressive invasively.
Right.
So they don't tend to give metastasis, that means
Spread
other
to other.
tumor in other part.
Yeah. Yeah.
The big problem is that to take out the nerve tumor,
Mm.
especially if take some nerve, you need to take out the limb.
Yes. Yeah.
But to be sure what to do, you need to know how extensive is the tumor.
Mm.
And for that, you need MRI.
MRI. Yeah.
Yeah,
So she ended
because
up having all four kind of
yes,
diagnostic imaging.
yes.
Yeah.
And on MRI, you see, well, there are different sequence, but you see on the left side, white round lump
Yeah.
that is quite asymmetric. I don't
Mm-hmm.
know if you see my arrow. Probably not.
You can't see your arrow, no.
Yeah.
Oh yes, I can
However,
see it. We can see it. We can see it.
okay. So this is the tumor.
Mm.
And on this side, but you see that this is the nerve on the other side. This with the
Yeah.
contrast, the tumor is taking the nerve. This is the tumor. And the good news is that they were thinking that was not invading the central nerve system.
Yeah.
So taking out the limb will cure the dog.
Would be enough.
I love
Yeah.
this wonderful Spider-Man that is looking
Yes.
at you.
Yes, it is. Yeah.
But the good news that they decided to take out the limb of the pesta, and
Okay.
they create a very nice prosthesis. And
Okay.
she did really well. And actually, she survived 2 years, and
Really?
she didn't have a recurrence of the tumor.
Okay. Because I
And
think there's
this,
always a risk, isn't it? Amputating a
yes,
limb when you know you've got arthritis already in that other forelimb.
exactly. The reason why they decided to take out this limb is because she was starting to be really painful.
Right.
This kind of tumor, sometime the end, when they affect the mechanical part, you just
Mm,
lose the limb. You don't
mm,
feel the limb, so they are paralyzed. But
yeah.
if you arrive to the inner part, they create really high pain. And
Mm,
she was started to be extremely painful, and she
yeah.
was already not responding to any kind of treatment.
Right.
But after taking out the limb, she was the happy dog that she
Oh,
was again, and she was so proud with her.
the
Uh,
prosthetic.
yes, and she did very well for 2 years.
And what country was that in?
This is Italy.
Italy. Italy. Okay.
Yeah,
That's really because the other thing I was just thinking when you were talking through it was whether she was developing more of a bony tumor. I was thinking along the lines of tumors, but then actually the time frame would have been too long because the bony tumor would have happened a lot quicker than the nerve
yeah.
tumor.
Yeah, and usually we would have probably pick up on radiograph. Sometime
Yeah,
not, because when we are very, very on CT was done 2 months later,
yeah,
and then with bony tumor, after a while they are so painful that on
yes,
physical examination is much easier to localize the problem.
yeah,
But these kind of conditions are really subtle, are a nightmare for the vet,
yeah. You don't
because
feel anything really.
you cannot see them on CT, you cannot see them on radiograph.
No,
Sometime actually you can see something, because going backward on CT, there was a little bit of asymmetry on the nerve,
oh,
but
okay,
again, to be sure, you need an MRI.
yeah,
And then, the good part is that every diagnostic imaging look a different aspect.
yeah,
The
yeah,
bad part are expensive.
yes. But in a case like with her, it just goes to show that you need all of them, and sometimes that is
Absolutely.
just the way it is. And
Exactly.
you could have done those radiographs and gone, well, it's probably because of her arthritis. It's just that, and then you feel like you're failing, don't you? And without that
Yeah.
MRI, probably she would have been put to sleep because we wouldn't have come to that
Yeah.
diagnosis.
Yeah. And, we actually did and doing the diagnosis with ultrasound, because the nerve tumor was quite peripheral
Right?
and was possible to see. But when you have this kind of tumor close to the spine,
You
you
wouldn't put
cannot
that down.
arrive there in ultrasound. And even if I had a diagnosis with ultrasound, I would not be able to tell you how extensive is the tumor.
Yeah, yeah,
And the big problem is surgical, because the spine is free,
yeah.
or it's not surgical. So I
Mm.
really need to consider, for example, cutting the nerve, try to a way to avoid
The
pain,
pain. Yeah.
but it's no sense if you cannot take out the tumor, take
Mm.
out the limb,
No.
because then in 3 weeks the tumor will be back.
Yeah. It's a really interesting case. Really, really
Yeah,
lovely way it's been, progressed and taken so long and to get to that diagnosis. And it's just reassuring in a way to know that that can happen and that
yeah,
because sometimes we have this conversation quite a lot of with older dogs that are in pain. We think it's just arthritis, and we say, well, we can do this,
yeah,
this, and this, but just because we can do it doesn't mean we should do it. Because sometimes you feel that pushing for all these kind of diagnostics is not in the interest of that dog. Whereas in this case, it obviously was the best thing to do because the outcome was the best it could have been.
yeah. And of course, at the beginning, she was responding to
Yeah,
painkiller,
yeah,
because the first time they give painkiller, and for the 1 month was normal. And
mm,
sometimes When you have an aged patient, just a little bit lame, the vet tend to give some, just a test to see if it's something terrible or not. But when the pain came back,
Yeah.
radiograph, okay,
Yeah.
arthrosis
Yes.
should be it. But
Yeah.
when the treatment fail, then
Mm.
there is something different. And this
Yeah.
is when we need more to arrive to the final diagnosis.
Yeah. It's really clever what people can do nowadays.
Yeah,
Um,
that's
I'm just going to pull up because it's kind of relevant for her.
true.
Pull up a question. What was that?
Yeah, yeah. Well, this is one of my patients, and
Okay.
she has a chronic tendonitis. She's 2. The
Right.
problem is she is the dog of a dog trainer,
Oh,
and
okay.
the owner is working on a dog, and she is spending all the time the owner is working on the dog,
Mm.
on another dog. She's jumping like 10 hours a day.
Right.
And so I'm really scared that she's going to develop tendonitis and arthritis
Yes.
because she probably will jump 1,000 times every
Oh,
day.
she just doesn't sit
so,
still.
so this to tell you that our dogs are fantastic, but we need really to be careful what they're doing in their life.
Yeah.
And for example, I suggest to the owner to avoid to have so many hours the dog jumping on this
Mm.
chair
Mm.
because it could be a problem.
It's actually, yeah. Yeah, absolutely.
Yeah.
It's just a
Okay.
problem waiting to happen, isn't it?
Yeah. Okay. This was what I had for you. I don't know what time
Yes.
is it.
So diagnostic mindset is what you were talking to me about before,
Yeah.
wasn't it? Which is your new enterprise.
Exactly. Basically, for veterinarians that are interested in diagnostic imaging of basically radiograph and ultrasound, there are cases, and I'm trying to create a community to be able to increase our knowledge because it's a quite new field.
Yes.
And more we know, more we can help our patient.
Yeah. So I'm going to be signing up because definitely I need to be knowing more from the expos that I'm taking. I do have just a little question here from Katerina from way earlier. She was just, at the beginning you were talking about when you're doing your ABCDs, about what you're looking for. So she was just sort of asking, can you talk a bit more about mineralization of muscle and why it happens, and if there are any ways to improve the tissue once it happens?
Yeah. Most of the time, when a muscle has a trauma, and most of the time, if it's a sporting patient, is a repetitive trauma. Imagine a person that run marathons. After 5 years of marathon, your muscle and your tendon will develop tendonitis because you will run too many kilometers. Human body is not built
Designed.
to be running 40 kilometers so often, let's say. So
Yeah.
it's an overuse.
Yeah.
If you have hemorrhage, most of the time hemorrhage, so a little break in the bone, in
Yeah.
the muscle, sorry, will end in mineralization. Is
Right.
a wrong way of healing.
Yeah.
The
Yeah.
problem, muscle is elastic.
Mm.
Mineralization is not elastic.
Mm.
So it will tend to be painful and create other chronic problem. To try to avoid that is very important for marathoners to do a lot of abdominal exercise because abdominal muscle will contract the Achilles tendon and will avoid this problem. The same in our patient. If we want to avoid to have mineralization in the supraspinatus muscle, that is
Over
the
that's
most
up in the
common
shoulder.
problem, yeah, we need to work on the triceps because triceps, that is the muscle in the caudal aspect in the back of our arm, are taking most of the weight of the supraspinatus tendon.
Okay.
So if our dog has a strong triceps, it will most likely develop less commonly mineralization in the
Yes.
supraspinatus tendon and muscle.
Right.
Once that there is mineralization, is a problem But I found out I saw a lot of patients with laser and ultrasound therapy.
Yeah.
They get so much better because
Okay.
mineralization, they became thinner. It's
Yes.
very difficult that they go away completely, but they
Yeah.
became less invading, and usually the surrounded muscle and tendon can run better. So I think that physiotherapy helps a lot. They have tried, especially in human, with microwave,
Yeah.
shockwave.
Like to break it up.
Yes, in dog you need sedation because they are really not nice, but could be an option. Surgery is not indicated because you need to cut the muscle,
Adding
you
trauma.
enter, take out the mineralization,
Yeah.
a little bit of bleeding,
Yeah.
mineralization
Restart.
again.
Yeah.
Yeah. So
Yeah.
usually I've seen patient, and I'm talking also of national champion in agility. They have massive mineralization, but they're doing great. And in this, physiotherapy is a really big help.
Like in the dog that you just presented with the nerve tumor, she had mineralization, didn't she? But actually wasn't really causing a
Was not
problem.
the problem. Usually, mineralization are the problem where are in a friction side. If they are
Yeah.
just inside a tendon,
They
is
get on
not a
with
big
it.
problem. But they
Yeah.
are creating problem the surface, then it's better try to treat. But nowadays, compared to 10 years ago, we can do so much
Yeah.
to increase our patient quality of life.
No, that's brilliant, and I think that's really well explained. So I'm going to wrap this up because I can see how long we've been talking for, and I have so many questions that I could just keep going on and asking you, but I won't. I'm going to join the forum and do it that way instead. So just to sum up, everyone's saying thank you, and just Lynn's comment, thank you. It was brilliant. It really was. And it's so nice when we have presentations, when we have x-rays and the images that we can really understand what people are talking about.
Yeah.
So thank you so much for sharing everything with us and explaining everything. And if anyone does have any more questions, please pop them on Facebook and I will have a look and keep an eye on them and get back to Giliola if there's something there. But yeah, thank you everyone for joining us, and thank you so much, Giliola, for giving up your evening to talk to us as well. And we will see you all again soon on camp. Have a great evening. Bye.
Bye. Bye-bye.